Hi, everybody, and welcome to Birth Talk. I'm Lynn Griesemer, and this is Jody McLaughlin, and we are here today to talk about childbirth, amongst other things. 10 things babies want us to know about birth. That will be our topic for today. So welcome here on Facebook Live. This is my 22nd episode since the Corona crisis, and I've really enjoyed it. I haven't done one of these in 3 weeks. I am winding down because I have some projects coming that I want to put my attention on for the next year and a half. But first, let me show you a couple of things that I have written and published that are available on Amazon.com and on my website, unassistedhomebirth.com, and also marriagecoachlynn.com. I've written some books on marriage and public speaking, and but for some reason, and I'm also was a homeschool mom. But for some reason, when this Corona crisis hit us, I felt a calling to present many talks on childbirth. I am a proponent of unassisted home birth, which means birth at home without a doctor or a midwife. And in 1998, and these came up in conversation before, so I thought I'd show them. In 1998, I self-published Unassisted Home Birth, An Act of Love. That's me and my husband on the front cover with our daughter Millicent, who was born August 3rd, 1996. So this book has definitely been out at least 22 years, something like that. So that's the first book I wrote. I produced a CD called Your Body, Your Birth. Sorry about the glare. Your Body, Your Birth, Secrets for a Satisfying and Successful Birth. That's a CD. We also have, this one came out in 2017 or 2018, my current birth book, Take Back Your Birth, Inspiration for Expectant Moms. This one's a little bit shorter, digestible. It's meant for anyone who's pregnant. The other two, the first resource is very specific, and the second two are more general. And anyway, so those are the 3 books I wrote. Recently, my husband and I published the second edition of a deceased author, Marilyn Moran, called Birth and the Dialogue of Love, also available on Amazon.com. And so we've been talking about birth for the last couple of months. These are very important topics, in my opinion. They're for you, for your service, for you to do what you want with them. They're also, all of these are on my YouTube channel, Marriage Coach Lynn. So why am I not doing more podcasts and more interviews? I love doing this. It's great. My husband and I have a goal to get this out-of-print book on electronic only, Pleasurable Husband, Wife, Childbirth, The Real Consummation of Married Love by Marilyn A. Moran. And so this has been out of print for a while, and we want to work on this, getting this up and available. That's going to take some time. And I'm so excited about my ebooks. I think Jody knows about some of these. And okay, so my goal in the next 2 years is to have 9 ebooks done. And I'm choosing electronic books just because they're not going to be long books. You can't really see it too well, but if you go to my website, unassistedhomebirth.com, you'll see a photo of this and what my intentions are, and I'll just read the titles. 6 out of 9 of these are pretty much done and just need some final touch-ups. Okay, the first one, the 4 secrets. Oh, no, wait, sorry. Top 4 secrets I learned from my unassisted home births. Another one, why unassisted home birth. Another one, unassisted home birth for fathers. That one will be written by my husband, Bob. Another book, Unassisted Miscarriage. The 5th one in the series is Unassisted Home Birth from a Catholic Perspective. The next one is Unassisted Home Birth, Another Side of the Story. Book number 7, A Brief History of Unassisted Home Birth. I'm working on that one right now, and I love that one. I'm getting to go back. I'm on Janine Parvati Baker is who I'm on right now. When the coronavirus came, I I took a break from writing, but now real soon I'm getting back to this because these books are really important. But I'm Janine Parvati. It's so nice to go ahead, Jody.
You said a brief history of unassisted birth?
Yes.
It's a long history.
It is, but I'm going to focus on from like 1950 forward.
Contemporary.
Oh, I might be changing the title. Okay, book number 8, Overcome Your Fear of Birth in 3 Easy Steps. And again, a couple of these titles might be changed. We'll see. And the last one, I don't even remember my anticipated title. So the last one is Mastering the Art of Childbirth, How to Have a Short Labor, Less Pain, and Sensual Pleasure. Something like that. It's a work in progress. But this will keep me busy. I'm done with 6 out of 9. But this, and guess what? And I'll try to make this really quick. So that is Your Birth Matters series and my Your Marriage Matters series. And I'm going to tell you, Jody, book number 3, I believe, is going to be my hardest one. Okay, so Your Marriage Matters series, book 1, Make Your Marriage Great, Clean of Heart. Book 2, The 4 Eyes of Friendship, Integrity, Interest, Intelligence, Investment. That one is almost done. Book 3, Sizzling Sex, Strengthening Married Love. I believe that's going to be one of my harder books. It's a very sensitive topic. We're talking about 15, 20, 25, 30 years of marriage. So that's a very sensitive topic, just knowing from counseling or talking with couples, whatnot. Book 4, Estrangement. Is This All There Is? Book 5, Fix Your Marriage This Weekend. And book 6, Before You Get Engaged, What to Look For in a Partner. As you can see, these projects will keep me busy for the next 2 years. That's my goal. So I got to get off social media. As much as I enjoy doing topics.
I want to say something here about the last book that you mentioned.
Yes.
My mom was dating 3 men.
Uh-huh.
And she knew that she was going to marry somebody because, she wanted to be the wife and, the mother and do that whole thing. And so of these 3 men that she was dating, she took care that they didn't know about each other. And so she asked herself, who would make the best father for my children? And then she picked my dad.
Wow. So she saw that as important. Would this man make an excellent father? That is really good because, marriage is more than just husband and wife.
Because she liked them all. They were attractive. They thought she was attractive. There was a chemistry there. My mom wasn't a runaround type of woman, but I'll show you her picture.
Okay. All right. Again, we're talking with Jody McLaughlin, and the topic for today, we're going to launch into real soon, 10 things babies want to know about birth. And this is a picture of your mom, and look for the glare. Be tilting it sideways. Back up a little bit.
Oh, here we go.
Yeah, look at that beautiful woman.
Isn't she absolutely gorgeous?
Yes. How old was she here?
Oh, probably 21, 22.
Okay.
Oh, no, she was younger than that. That was her graduation picture. So she was probably 18 or 19.
High school. Okay. Mm-hmm. Great.
And this is my mom and dad on their wedding day. Mm-hmm. This is the man that she thought would make the best father for her children. And he was a marvelous, marvelous father. And she was an incredible mom. And our whole family is so fortunate that we were blessed with parents who absolutely adored each other, looked out for one another, never found excuses to throw anybody under the bus, always accommodated one another's needs and interests. And it was a great family to grow up in.
Yeah, that's so important. We're actually, you look at today's culture and we're missing excellent family formation where the husband and wife love each other, where the kids are a delight, where families, they're friends with each other in adulthood and a strong foundation. So let's go into our topic, shall we?
Before we do that, I want to show you a little bit of research that I've done since we spoke last.
Okay.
And one of the books, oh, these are so heavy. This is Williams Obstetrics. It's the classic for obstetricians, for obstetrical practices.
Is it still used today? Still referred to?
I would believe so. I'm
Okay,
almost certain it is. I'm almost certain it is.
All right.
And back here in the index, you won't be able to see it from this distance. You'll just have to trust me. This is what it says.
Okay.
Chauvinism, male, variable amounts. See page 1 through 900 and
the entire book.
Yeah. Yeah. This is the 15th edition, which came out in 1971.
Okay.
Now, this next book I don't have, but I was able to get a copy of it from the medical library that I was using at the time. And this is a little different. We always like new and improved and expanded, right?
Correct.
So instead of chauvinism male variable amounts, it is now chauvinism male voluminous amounts.
Okay.
And it's page 1 through 1,100 something.
All right.
And that came out in 1980. So what it tells me is I'm not the only one who knows there's something wrong. The person who edited this saw it too.
And we don't know whether that was a male or a female who edited it.
A female, I believe. And some astute person noticed it in a future edition, and then they took it out.
All right. You know what? Why don't we talk about this topic, male chauvinism, patriarchy? We happen to have one male listening to us right now, Leo. Hi, Leo. I want to say that when we choose birthing at home, we are not making a statement anti-male, men are horrible. We are really making a statement that we as women believe that we know what we have inside of us to birth a baby, and we don't want to be directed. Oftentimes the doctors, now it's 85% female who make up the obstetricians. But there was a time where, and there's still an attitude amongst women that we have a patriarchy, the male is out to make money, and it's the male doctors. And we really don't want to share that attitude is not what we're talking about, right? So let's talk about, just for a minute or two, male chauvinism and how this plays into this topic of childbirth. So what are your comments?
First of all, I want to talk about chauvinism. When a woman is a chauvinist, what is that called?
A bitch? I don't know.
A chauvinist.
A chauvinist.
Yes, we've referred to chauvinist when talking about men so much that we don't know that the term also applies to women. Okay. Women can be chauvinists as well.
All right, very good.
Yeah, right. As more women enter the medical profession, some of them are head and shoulders above their peers, and some of them align themselves with their peers so as not to generate additional antagonism because she's competition, she's a woman, what if people like her better? So some women will ignore all that and they become excellent physicians. And some of them will try to play ball with the big boys, and their practice varies not very much from the rest of the guys. We also have some remarkable men who practice obstetrics very much like a very, very astute midwife.
Okay.
And generally, these lovely men have difficulties with their medical licenses, their hospital privileges, their role within the hospital, like losing the chief of staff status, things like that.
Mm-hmm.
So the system that has been created is equally hard on men and women if they deviate from the norm.
Okay. Good point.
Yeah.
And give me some examples of male chauvinism from an OB/GYN. A woman goes in to give birth. She has a male doctor. What are some things?
I'll just tell you what happened to me.
Okay.
So do I have to have an episiotomy this time? Well, of course you do, because you had one the first time. Then if you had one the first time, you always have to have one. Well, I've read, that if the woman assumes a position that doesn't stretch the perineum so much that she can avoid an episiotomy. What medical school did you drop out of?
It's an arrogance. It's an arrogance and a patronizing attitude.
Yeah, and it's hubris. How could you dare know anything that I don't already know? If I don't know it, that means it's not relevant.
Okay. All right.
This is one of my favorites. I was very active in the community, getting this kind of common sense. Our grandmothers knew this information out to the public. And the chief of staff at the hospital at that time, he was also president of the North Dakota Medical Association, went to my husband, the person I was married to at that time, and said, "Can't you rein her in?"
Yeah, not upholding your intelligence and your opinion.
He had tried to rein me in.
Yeah.
The person I was married to had tried to do that, but most of what I did was in secret. Not that I was ashamed of what I was doing or I wasn't proud of myself, but I found that I was far more effective if I wasn't unknown. So if I knew of something that needed some attention, I would have the attention brought to whatever subject that was, but not to me. Okay. I was simply the messenger.
Okay.
And I liked it that way because I had already learned that the real power structure is not going to be on the front page of the paper or anywhere in the paper. The real power structure is practically invisible, and they are unnamed.
Okay. Well, let's jump into our topic. Okay, so I'm just sitting here with Jody McLaughlin. We're going to talk about 10 things babies want us to know about birth. First of all, how do we know what babies want? Well, we have research, we have experience, and we'll talk about this, and you'll see if you agree with me, especially those of you who have given birth, who are listening, who know what went wrong, what could have been better, and we intuitively know, and the babies communicate to us, don't they? They communicate to us. They don't like ultrasounds. They flail around.
That's why when the ultrasound is going on, they're going like this. And
no, stop.
The not very astute practitioner will say, "Oh, look, he's waving at us." And he's not. He's trying to shield himself from the noxious stimuli that the ultrasound causes, just like the whales try to raise their heads above the sonar in Puget Sound here in the Seattle area. And if whales don't like it, maybe we can have a better understanding of babies not liking it either.
Yeah. All right. So you've sent me a list recently, and you've broken it down into, you just told me like 3 separate things. The babies before birth or at birth will tell us. What were the 3, just to give our listeners a direction we're headed in?
Well, these are things that our babies want us to know, but more importantly, these are things that the babies would really, really want the obstetricians and the midwives to know.
Okay. All right.
And anyone who cares about babies or cares for babies should have an idea of what the babies are saying to us, or if they could actually speak to us, what they would be saying. I learned a lot about what babies want from being with baby animals.
Okay.
And because those animals are mammals also, we have a lot in common.
Mm-hmm.
And so you don't take a kitten away from its mother, wash it off, and then try to give it back. She'll say, whose kitten is that? It certainly doesn't smell like mine.
Mm-hmm. Okay. All right. So number one, acknowledgement that obstetricians are overqualified to attend normal birth. Ratio of midwives to OBs is 10-1.
Ideally, that would be the ratio.
Okay.
Because obstetricians are absolutely vital in a system of optimal care for women. However, their skills are only required maybe less than 10% of the time.
Okay.
And so if we have midwives or other non-medical people who are attending to the needs of a woman, even if it's someone who is just there to clean up any spills or bring water or whatever. I talked to a woman one time who booked a motel and had her baby there because no one in her home appreciated her interest in having not only a baby at home, but having a baby at home by herself. So she booked a motel room, and she was telling me about her birth, and she was fine, and the baby was fine. And I said, would you do it again that way, or would you want someone there? And she said, I want someone there. I said, in what regard? She said, someone to thread the baby between my legs so that I could start nursing.
Okay.
Someone to bring me water.
Mm-hmm.
Someone to mop up the floor. Someone to be my servant.
Okay. So 10-1. Obviously, our country and many of Western cultures do not have a 10-1 ratio. 10 midwives for every one obstetrician. It's almost maybe the opposite. And so hold up your little prop. Why aren't we likely to change that ratio? The golden egg.
Yes.
Because this system has a lot of money in the tune of probably over $1 billion.
Bad babies generate way more income than good babies.
Okay.
And it was beyond me why our focus was not on having good outcomes.
Right. And we've talked about this in other episodes. So thank you.
Yeah.
Shall we go on to the next one? 10 things babies want us to know about birth. The second one. And we probably have 15. Some of them will go through quicker than others. We don't have
babies don't know how to count.
Oh, babies don't know how to count. Very good. All right.
They just say 10 when they mean a bunch.
Right. Okay. So no restraints or imposed positioning during labor and birth. So that you can be very brief, or maybe I'll just go on.
This is something that that came out of Principles and Practices in Obstetrics by DeLee. And there is a photograph in here of a woman giving birth, and it says Indian. This is how an Indian would give birth. And I don't know what it is about the body of an Indian woman that is significantly different than the body of any other woman. Mm-hmm. But evidently an Indian woman does better if she gives birth vertically, but for some reason that doesn't affect other women.
Okay.
I also looked through the index here. I'll have to switch out my glasses for a moment.
Okay.
And I found a reference to gravity.
All right.
There was not a reference to gravity in any of these other books. Gravity plays but a small role in labor.
A small role?
Yeah, evidently. This phrase is what one would call damned by faint praise.
Okay.
When it's given a tiny, tiny, tiny bit of consideration, but mostly it's irrelevant.
Right.
And this came out in 1933.
Okay. That's the year my mother was born.
Yes.
All
and I marked it so lightly I can't see it right now, but that's okay. Oh, yes. The Chamberlain brothers, who invented the forceps, had printed for the delivery rooms, primum non nocere, which means do no harm.
Yeah, first do no harm.
Right. And on their forceps, they actually had printed in Latin, but not force, but skill.
Okay.
Yeah. So this was the art of using forceps, not using brute force, which is
all right. So
happens.
the babies would love to have nothing imposed on them, so that their mothers can help them do the job and get out into the world. So
yes.
Okay, we talked about that. Use of gravity encouraged and accommodated. Episiotomy and forceps discouraged. Okay, why does the baby want an episiotomy and forceps?
Well, when the woman has an episiotomy, she is more likely to have a severe tear. If she's in the vertical position without her legs splayed to accommodate the restraints that she's in for a typical obstetrical birth, where she's in the lithotomy position, there's actually more tissue to stretch around the baby's head because it's not accommodating. Like if we take our skin and we pull it like this, we're stretching it, and it's more likely to cause a tear. So, and the other thing that happens is when there's an episiotomy and oftentimes a tear resulting from that, the baby does not get what is called the baby Heimlich. Okay. When the baby is born through an intact perineum, it actually helps the body cavity to expel fluid that it doesn't need anymore.
Okay.
And so the baby Heimlich is an important feature for the long-term health of the baby. And, they can cough and sputter and get that stuff out. And they do not need this. Right. This can be very, very painful and aggravating and cause the gagging reflex. And, there are babies that have been so traumatized just by this little bulb because it's used so forcefully up in the nose and in the mouth and throat. And as I said before, the best way to extract additional mucus and stuff from the baby, if it needs to be done at all, is with the mother's mouth. Okay. And that's the old way.
Yeah.
And it also is the baby with the mother's organisms, which is a good thing.
The new way of doing birth employs a lot of people and justifies the professional existence for a lot of people. Look at me, I can help. I'm useful and I can do this in the birth process. And so
speaking of help, I have an angleworm farm. I farm angleworms. And I was doing some research on angleworms, and I looked at a YouTube video, and this guy had videotaped angleworm births. Mm-hmm. I thought, oh, this should be interesting. And here were the little angleworm eggs, and he had a pinpoint forceps and like a flat tweezer type thing, mm-hmm. and he was piercing the egg and squeezing out the babies.
Wow.
And I was, we are so fascinated by birth that he did this repeatedly, and he filmed it and put it on YouTube because, it wasn't the birth of the angleworms. It was him forcing the angleworms out of their eggs, and maybe prematurely. I don't know if the eggs had, or if the angleworms had any problem, but the act of birth, to witness a birth, whether it's a hatching of an egg or an animal at the zoo or a human being, we are absolutely fascinated by birth. There was the little tiny monkey. I can't remember what it's called, but it's one of the tiniest monkeys, and it was in a zoo environment, and they have the lights on all the time. And when the monkeys gave birth, the other monkeys became so excited and so agitated they accidentally ate the babies.
Oh.
And in a normal environment, they would give birth invisibly in the dark, without all the agitation and interest of the other monkeys. So what I'm saying is birth is fascinating, even for monkeys, but it's supposed to be private.
Right.
I like the way elephants give birth. The mother elephant is in the middle, and then the female patriarchs will circle her with the tails in and the noses out, and the male bulls are monitoring the perimeter.
Okay.
And so she gives birth in private because nobody is facing her. Everybody's facing out of the circle.
I think the same is true with dolphins. That they form protection against predators. I would love to see that someday. I think I'm going to watch some YouTube videos on that. Do you know I swim with dolphins. Sometimes when I'm out swimming, I the closest I've ever been in the wild swimming was maybe about a month ago, Anna Maria Island, and I took a breath, and within 6 feet of me, it was jumping out low, and it was big. It was to be just 2 arms length away. I was like, wow. And they were actually swimming with us. There were about 10 of us swimming, and they circled around one swimmer.
How fun.
Oh, it was beautiful. It's just, and we mind our business and they mind their own business, and everybody's fine. And it's wonderful. All right. Next one is no, and I've talked about this with Lynn Reed and others, no cutting of the cord until the baby has their first nursing, or not cutting the cord to let it release on its own reduces infection rates. And also very important for the baby's respiration, wait for it to stop pulsing, wait for that cord to turn white. So those of you listening who are planning on a hospital birth, please be respectful of that cord and be assertive and tell your medical folks to, just wait. I want to wait.
No.
What?
No, you don't even have to give an explanation. It says, don't cut it.
Don't cut it. All right.
And,
in your mind.
You can talk to them about it beforehand, what your reasoning is. But when you're in that moment, don't think that you have to explain it, because if they didn't hear it before, they're not going to hear it now. They cannot process it. So just say no.
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 Right.
They for some reason, the laws within a medical institution say you have to respect when a patient says no.
Yeah. And I've even gotten to the point where my radical attitude is, and I've never done a lotus birth. A lotus birth is where you just don't cut the cord. You just wait. You wait for the placenta to come out. You wait for it to dry up.
Release on its own.
Release on its own. And that could be anywhere from 1 to 7 days. Normally, is it 2 to 3 days, 3 to 4? And I didn't do that with my last 2, but I got to the point where if I watch a cutting of the cord on a birth video, I feel like it's abusive. It's like a slice. It's like you're cutting the child.
It is a severing. It is a severing, which is not of the baby's choosing. Now, this is what babies want. Babies want to be born and to take a little breath, just to see how that goes. Oh, that wasn't too bad. Okay, now I'm going to try another little one and see how that goes. Okay, that was all right. Well, now I'm going to take a little bit bigger breath and see how I manage that. And so they can start breathing on their own in increments because they're still getting oxygen from the mother's system through her respiration via the umbilical cord. Now, if the cord is cut, clamped, and or cut, the baby has to breathe or die.
Okay.
And I think this is true for myself, and it may be true for some others. When I become very stressed, I don't breathe.
Interesting.
Until I absolutely have to. And sometimes I have to remember, don't forget, take a breath. And maybe I was one of those people whose cord was cut right away and I had to breathe or die.
Oh, I see.
It was very, very painful to take that first inspiration, that first respiration, or else you're going to die.
Yeah.
And so I like the idea, and babies like the idea of them having a bit of a transition time.
Yes.
Where they can, do this, and when they're ready to do it on their own, they're home free.
They're getting to know a brand new world. They were in utero, a nice, comfortable, safe world, hopefully healthy, the healthy mom, and then now they're out in a new land. So,
well, not only that, but the blood that they receive is 1/3 of their blood volume.
That's major. That's major.
It is major. Can you imagine what happens to their internal organs and to their brain chemistry when they're born having hemorrhaged 1/3 of their blood? And it's not that they've hemorrhaged it, it's that it was denied to them. Yes. And so one person said it's like being born phlebotomized, which is to have blood removed.
Wow.
And so for that reason alone, and there are some who say that some of our children are having XYZ problems because they have been denied this vital blood supply at the time of birth.
I would believe that. Yeah.
As far as freezing and banking your cord blood, I think it's a gimmick. Yeah. I'm not real sure. I know it costs a lot of money to bank your blood year after year after year in case you are going to need it. But the best place for the blood is actually in the baby's system.
Okay.
Because then they can use it right now and you don't have to pay anybody to hold it for you.
Right. Very good. All right. Next one. Highest priority is for baby to nurse during the first hour. Every baby receives colostrum, even for those mothers who do not intend to breastfeed. So talk about that.
Well, colostrum is absolutely vital for the digestive system. And on the farm, we had dairy cows, and, don't send me any, angry letters because of how we exploited our cows. But we did take the babies away shortly after birth. But we absolutely made sure that every calf got the colostrum.
Okay.
Or else we were going to have problems. And I found out from another friend of mine who had sheep as well as cattle that if the baby for some reason didn't get the colostrum, it's better to have colostrum from a different animal on the same farm.
Okay.
Than from the same animal on a different farm.
Okay.
So if you need colostrum for a calf, then you would use your sheep's colostrum.
Yes.
And that would be better than using cow colostrum from the neighbor's farm. And so colostrum is absolutely vital in animals, and it's absolutely vital for humans. And sometimes when a woman nurses just that one time, and just so the baby gets a colostrum, she can go, oh, this isn't so scary. Maybe I'll do it a couple more times, but that's all, just a couple more times. And then after that, well, maybe I'll do it for a couple of weeks, but that's all.
Yeah.
And, well, maybe I'll just do it for a couple of months and then I'll be done. And then, she lets the baby start directing her, and then, things can work out. One thing Dr. Michel told me was he was working with a woman who fully intended not to breastfeed, but she was under the influence of these incredible hormones after her spontaneous birth. Of course, her baby has these incredible hormones of attachment following a spontaneous birth, no medication to interfere with it. And in this state, she forgot she wasn't going to breastfeed.
Good.
Put the baby to breast, and the baby started nursing, and it was only sometime later she said, "Oh, I forgot. I wasn't going to do that."
Yeah.
But the chemistry of attachment just took over, and she forgot that she wasn't going to do that.
And I know for the young mother, the new mother with their first child, sometimes it can be arduous, very difficult work. You start breastfeeding the baby and you get sore nipples. I got sore nipples. That was very difficult. Also, you may have a hard time dealing with loss of sleep or less sleep at night. So it takes a lot of perseverance for that young mother.
The reason we're supposed to lose sleep, because it's a common complaint all over the world, is losing sleep. The reason sleep loss is vital for the survival of our children is because it creates a situation in the mother's system where she is more likely to meet her baby's needs sooner rather than later.
Oh, that's so good. That's very positive.
It lowers her resistance to conforming to society's standards instead of what it is that her baby needs. She's too tired to fight with a baby, so she just gives the baby what the baby needs.
Good. That's really good, because a lot of women do give up. They give up after 3, 4, 5, 6 months. They're exhausted. And women, like we've said on this,
we understood the role of exhaustion in helping us to meet our baby's needs better. The exhaustion is supposed to pull ourselves away from the outside influences and to our baby only.
But here's the conundrum. Many women want to get back to their pre-pregnancy weight. They want to get back to their life. They want to keep their house clean, socialize, invite people over. Women need to know when they become mothers, everything changes, and it should.
Well,
and
if they have those priorities like really fixed in their mind, they should get a puppy.
You and I were talking about this. I was talking with Jody about the fact that many women are nostalgic. Oh, my son is 18. Oh, my son is 22. I wish he could be 5 again. Oh, that was nice when they were little children. And Jody's response is, if you want a toddler, if you want a perpetual toddler, get a puppy.
Yeah. Dogs stay toddlers forever. And if you want someone who's not going to complicate or influence your life that as much as a human baby does, go to your pet shelter, please. There are so many little tiny creatures there that really could use that time and attention, but you don't have to get a babysitter for them if you're going to be gone for the evening.
Yeah, that's good. That's good. Okay. So breastfeeding is very important, as we've talked about. Okay. No prophylactic ointment or silver nitrate drops in the baby's eyes. Instead, the mother will be screened for venereal disease or sexually transmitted infections, STIs.
As I understand it, it's easier to put that caustic material in the baby's eyes than it is to ask the mother and the father if they've been with anyone else throughout the pregnancy. Because even if during the pregnancy she tested negative, if they did do that testing, he could have been with someone else and brought an infection home and gave it to her, and now it's in her system when she's giving birth to the baby. And we do not want babies to be blind. I certainly get that. But there's a whole lot of people who are faithful to each other, not only during pregnancy, but during their whole marriage. So if you're one of those people who knows that you're okay, say, instead of treating my baby, test me. And if I test positive, then you can treat the baby. But if I don't test positive, then it's unnecessary. And babies have a focusing distance, like about that. And if you put this stuff in their eyes, they lose the ability to focus properly. And not only that, but it makes the baby so unattractive. This red goopy eye. Have you seen any newborn pictures and the baby's eyes are all red?
Years ago I did. Years ago, and it's terrible.
And babies' eyes are supposed to be the most endearing quality about them, about their little faces. And oh, he looked right into my eyes.
Yeah.
You know, you hear parents say that, he looked right into my eyes. Okay, now we have a baby that's had the silver nitrate or the salve or whatever in their eyes.
Yeah. Well, also, Jody,
baby, look into the soul of their parent.
And the baby is bonding with the mother, and 8 to 10 inches is, they're looking for the breast, they're looking at the mother's eyes, and they're starting to focus and bond with you. So that just kind of disorients babies.
Yes.
All right. No, this is
if you do have a venereal disease, and it's a legitimate practice, but it should not be done prophylactically, just in case. It should be done because there is a need.
A need, yes. And that's exactly, again, the golden egg. Many people X-ray.
No, this is more than the golden egg. This is, do we really want to ask this new mom and her husband partner whether or not anybody, because she may be the one who has been with somebody else.
Right, yeah, okay.
And so, I mean, it's really awkward, and people aren't going to tell the truth anyway.
Correct, yeah.
So because they can't trust the answer, they'll treat the baby instead of even asking the question or doing the test.
Okay.
So just volunteer to have the test done to spare your baby the foggy, weepy eyes.
Yeah. All right. What about this one? No baby bath. It's okay to wipe blood or feces, but no baby bath. So say a couple minutes about that.
The first home birth that I was at, the mom and dad were having the baby by themselves, and I was there to take care of the 3-year-old, should she wake up.
Okay.
And it just so happened I was there, and she gave birth on her hands and knees, which means her rectum was above her vagina. And so as she's pushing the baby out, a little piece of poop ended up on the baby's forehead. And I said to myself, Self, what am I supposed to do? Oh, I grabbed a bit of Kleenex and I just wiped it away. I knew that nobody was going to get infection. It wasn't going to be a horrible thing, because all mammals are born between where we poop and pee. Right. So there must be a really, really important reason for that. And it must have something to do with colonizing our orifices with the organisms from our mother. So I wasn't freaked out. I just thought the proper thing would be to say nothing and just wipe it away.
Okay. Very good. All righty. Let's see.
Oh, and the reason the baby should not have a bath is because the baby absolutely loves how they smell. Mm-hmm. They love how they smell, and the residue of the amniotic fluid, on their hands, and as coordinated as they can be, they're, smelling this, and the areola, the dark part of the breast, smells like the amniotic fluid, so it helps the baby to zone in on his nourishment.
Oh, very good. Yeah.
Yes. And we also have to remember that amniotic fluid is baby pee. Mm-hmm. And, we also know that baby pee has urea in it, which is a good skin softener. Mm-hmm. And there just isn't any good reason to wash off the Vernex, which is a wonderful emollient to keep the skin soft and healthy. It's antibacterial, it's antiviral. There's absolutely no reason to wash off the good stuff with something that's antibacterial.
Yeah.
Which smells funny. And we want our babies to smell nice, because That's one of the things that helps us to attach to them. We don't want them smelling like something else. And babies don't want to smell like something else. They want to smell like themselves and like their mother.
All right. All right. So welcome everybody who's currently watching. Type in any questions that you may have and I'll read them to Jody. And I have a question. Vernix. Many babies are born bluish, purplish, but there's a certain percentage of babies that come out and they've got a lot of white, almost like cottage cheese. It looks like Desitin ointment. It's white. And the people who aren't used to, you're not used to seeing this. You might think, yeah, take a towel and wipe that off, but you can rub it in. So tell me what percentage you think, if you know, are vernix, a lot of vernix covered on a baby, and what that might mean.
Only the lucky ones. And what it means is the midwife, I don't know of doctors who would do this, but I know of midwives who've done it. They'll take a little bit of it from the crease of the baby's arm and they'll put it on their, the parts, where they're prone to have some wrinkles.
Okay.
They borrow a little bit of the baby's vernix for their own vanity. And I'm okay with that. I think that's a lovely thing to do.
But the purpose, why do some babies have vernix and some don't? Is it a dietary thing?
I think some babies have more vernix in appearance because it is whiter or more viscous.
Right.
And for other babies, maybe it has something to do with the amount of amniotic fluid. Some of it, of the vernix, ends up in the amniotic fluid, and it's like taking a vernix bath.
All right.
And I would say that the luckiest of the babies have an abundance of vernix, and that if you're looking at your baby from an aesthetic point of view, it certainly is appropriate to tidy up their beautiful little pink faces, but they don't need to be washed, and they don't need hexchlorophene, and they don't need any kind of antibacterial. They don't need to be immersed in water.
Right.
That can come weeks later. This is important. We don't know why baby baths are so important. We honestly don't know why. But there was a situation where a mother had decided that she wasn't going to bathe her baby, not for, a week or 2 weeks. Once the baby started smelling ripe, that would be the time for the baby to have a little swishing bath.
Okay.
And the baby's grandmother called every few days. Has the baby had a bath yet? Has the baby had a bath yet? Well, no, but probably tomorrow.
Yeah.
And then tomorrow she'd call, did you give the baby a bath? I mean, she was so vigilant.
Yeah.
And then there was the woman who almost everything went wrong with her birth. It wasn't what she had wanted, and perhaps it was one of the truly necessary cesarean sections, which we have to expect from time to time. But anyway, in this feeling of nothing went right, at least she said the baby is not going to have a bath.
Okay.
And they insisted on bathing the baby, and she said no.
Yeah.
No. You're not.
Whose business is it? That's what I want to say, Jody, about half this stuff. Whose business?
She can't be in the nursery if she's not bathed.
Yeah.
And the mother said, fine. And so they put the bassinet in the mother's room and put a sign in there saying dirty baby. And she was so proud of that sign that said dirty baby that she put it in the baby book to show her daughter, see, I did advocate for you.
Yeah. All right, so let's just talk about vernix one more time. I've had 6 children, and only my youngest, Michael, who just turned 18 a couple of days ago, only my youngest was covered in vernix, and I blamed myself because I didn't really have a good diet. I had, I think, a little too much sugar, and so I thought vernix was related to my diet. But here's what Martha says. Hi, Martha. She says, it was my understanding that copious vernix caseosa was an indicator of earlier or younger gestation. And Mikey, I thought he was about 2 weeks early, but he was like a 10-pound baby. So I don't know. So thank you, Martha. It's worth.
He was a first strawberry on the bush to ripen.
Okay. Yeah, that's good. Good way of putting it. All right, let's move on. We are at 55 minutes and we still have about 5 or 6 to go. So maybe some of these we can whip through a little quicker.
Okay.
No routine separation of baby and mother. We've talked about this many times. For bonding, immediate, the baby should be brought to the mother's.
Human mothers and babies are mammals. You do not separate a mammal from its mother, period.
You don't take the baby away for measuring and cleaning and whatnot, and to get the baby labeled and stamped and whatever. All right, no separation, no baby hats. The physiologic loss of heat from the baby's head will be replaced by warmth from the mother's body. And that's nice.
The baby loses, I've heard 90% of their heat through their head. Well, if all babies lose 90% of the heat through their head, they're supposed to.
Yeah.
This is not an anomaly. If something happens over and over and over again, there's something useful about it.
Okay.
And the cooler head can prevail. And so the head cools and the warmth is replaced by the mother's body, which means she has to be in close proximity to her baby.
Okay. Thank you. All right. Next one. No vitamin K or other prophylactic vaccinations. Definitely. The baby's immune system is not ready for all of that, all the stuff we want to
We give babies vitamin K because we want to prevent hemorrhage. But the best way to make sure the baby doesn't hemorrhage is to make sure they get all their cord blood and, they don't have their cord clamped and cut right away. If we're really worried about the quality of the blood volume in the baby's system, we can't be doing this.
Right.
And we also say, well, if the baby's going to be circumcised, he needs the vitamin K to prevent bleeding. Well, the best way to prevent bleeding for a little boy is not to circumcise them.
Correct.
And because we are so billing code conscious, here's the egg again.
Yeah.
Now we give little girls the vitamin K as well as the little boys, even though in our culture we don't amputate part of our baby girls' genitals.
Right.
But they get the vitamin K shot too. So, you can't have it both ways. If you want the baby to be well, then make every decision based on that.
All right, a couple more. Highest priority is the baby mother-parent attachment. Nothing will be done without cause, which reduces the vital love, positive hormone release in the mother's and baby's endocrinic systems. What is that a typo? The endocrine hormone. Endocrinic, whatever systems. Okay. Mm-hmm. Yep, that's good. Reduce the release of stress hormones in mothers and babies. So just the whole process, right?
Mm-hmm.
We've talked about the process in some of these.
If we stress a cow too much, she will run away from her calf and she'll never come back. If we stress a mother too much, she will avoid the attachment to her baby because her emotional resources are so depleted. If we traumatize the baby too much, then it says it must be my mother's fault because she's the one who's supposed to be taking care of me. So how come my mother let this happen to me or let that happen to me? One way that we can ameliorate those issues is talk to our babies.
Yeah.
Trust me, our babies not only can they understand what we're saying, they can read our minds.
I believe they can. They know, yeah. and they know us. They've known the mother for 40 weeks. They've gotten to know you before they emerged into the world.
They are so close to their creator.
Yeah.
That they know things. And they want us to know these things too.
And that is not only true for the birth process, having stress at the birth process, stress immediately after, and stage 4, whatever, the first month or 2 months, young mothers might have to get assertive with their mother-in-law. Did you give the baby a bath? Can I come over and see the baby? Can I hold the baby? Oh, can I feed the baby? Just pump the breast,
You can come over and do dishes.
Yeah.
You can come over and vacuum. You can come over and do laundry.
Clean my bathroom. Make some meals. Make a few meals for the
Because
family.
when people want to help, it's a nice thing to let them help, but be very specific about what help. It's not that they take care of the baby so you can make supper.
Right. They make the dinner. Yeah.
They make the supper. Yeah.
Good. All right. Very good. And that stress is very important. No relief bottles or pacifiers. Baby has continual access to his mother's breast. And I think it's gotten better with breastfeeding. In 1988, the nurses would recommend, 15 minutes on one side, watch the clock, 15 minutes on the other. And now I think more women are given the advice to let the baby, you don't have to do equal amounts on equal sides.
Yeah.
Because most mothers, guess what? Most women have a breast that's slightly larger than the other, and the baby finds this out right away and might favor that side. Okay. What's wrong with that? Yeah.
And the baby also learns that if he's pretty hungry but almost full, if he stays nursing on that breast, it's like dessert. The milk is richer and sweeter. And if he switches, then he's going to get the milky milk still, because the milk that comes after is always richer and sweeter. And so the baby learns. He learns if he smiles, if he pats the breast, if he makes a cooing sound, the mother will have a secondary letdown reflex, and that's when the really good stuff comes.
Oh, excellent. And so new mothers, stick with it. Just keep going. You might be tired. You don't quit. Well, I think a lot of people.
Just someone who has successfully nursed their child, because they have been through the seasons of breastfeeding, and pretend that you live in a cave someplace, and what would you do? You baby, what should I do? And baby has a way of letting you know what should be done. And if you want the baby to be gentler, you can ask that. Ask your baby for what you need as well.
Yeah, it's wonderful. Okay, let's see. No circumcision of those who have not given personal consent, period. We don't even need to say any more about that.
If someone wants to be circumcised, I don't have a problem with it, but we do not impose that on someone who has not consented.
Yeah. Okay. And the last one we have here, ongoing community support for breastfeeding information and support. So to give your baby what it needs, you might have to do research. You might have to learn about breastfeeding. It doesn't come 100% natural, especially when you have problems, to reach out to women who have breastfed longer than what you think you want. Find a woman.
If we lived in a culture that embraced breastfeeding, we wouldn't have to have breastfeeding support groups, because everybody would know all this stuff, and we could just ask our neighbor or our sister or our mom. Very good.
Very good. All right, everybody. So we've been talking about 10 things that babies want us to know about birth. And I've really enjoyed these talks. Thank you for tuning in. Thank you, Jody. You've been on the show for about 6 times, and it's been wonderful. I'd love to continue, but as you know, I want to get cranking and writing the other books I have in mind. And I'll do Facebook Live if and when the occasion strikes me. And so thank you so much, Jody.
It has been so much fun.
All right. Thanks, everybody.